All right, then. So on this first segment of the program, we are continuing the dialogue with Rjolad Hospital. It is their intention to ensure that Nigerians live well, and that is why they started this 4 weeks campaign on how we can live healthy. Well, last week was World Diabetes Day, and we did have a kind of focus on that. But diabetes is one very, very serious ailment that requires more than one conversation. And that's why Rjolad is taking it to another level this morning to help us understand why we need to manage diabetes. So we're focusing on enhancing healthy living through comprehensive management of diabetes. And joining me in the studio this morning, Dr. Raphel Ibidapo is consultant endocrinologist with Rjolad Hospital. It's nice to have you in the building. Good morning.
Good morning.
And how are you doing?
I'm great.
Wonderful. So when we come across professionals like you who are very, very rare, there's always that temptation to ask, how it is, especially for endocrinologists like you. For those who might not understand what you do, really, who are endocrinologists?
So in a word, endocrinologists are specialists who are trained to manage hormonal disorders, endocrine disorders, diabetes, thyroid, any hormonal disorder in the body.
Okay. So they are endocrinologists.
Those are endocrinologists.
Do we have many of you around?
We are not many. Quite a lot of people at least gone out of the country due to the so-called Jackpot syndrome.
Yeah, so the migration is still on.
Yes.
So if we put a figure to the number of endocrinologists we have in Nigeria today.
I don't think we're up to 150.
You mean it?
Yeah.
Wow. That's scary.
Yeah, and the number keeps dwindling every day.
So that means we need to train more and get more people into the system.
Yeah, apart from training, of course, better welfare for people.
Yeah, so I think that's a very, very big issue, which the government is trying to tackle from time to time. Let's focus on diabetes and comprehensive management. What kind of ailment is diabetes? I need to talk to my listener this morning.
Yes, so diabetes is a chronic metabolic disorder, and we know that there's been an increase in the prevalence and incidence of diabetes globally, much more in the sub-Saharan Africa where Nigeria is located. So it's a debilitating disease if not properly handled, and we at Rjolad are kind of positioned to help patients who may be suffering from diseases like this. Right. Screening, in terms of screening, diagnosis, and proper management.
Is it infectious?
It's not. It's not an infectious disease. It's a non-communicable disease. It's one of the most common non-communicable diseases, right, apart from hypertension.
So when you say common now, I needed to put some figure to it. So if we are 10 in this room, Dr. Ibidapo, how many of us will come down with diabetes?
Yeah, it is projected that 1 out of 10 persons will have diabetes in Nigeria, and that number is even much more, could be higher because of our lack of data in this part of the world. It is projected again by the International Diabetes Federation that close to 800 million people will be living with diabetes by the year 2035. So those numbers are actually very scary.
Very, very scary indeed. 800, that's no small figure indeed. Absolutely. All right, so a lot of times we want to believe that, or some of us have this conception or misconception that diabetes is a disease of sugar. Is that correct?
Oh, well, it's not only a disease of sugar. It's a disease of both protein, both fats and carbohydrate metabolism. Ultimately, what you have is elevated blood glucose or elevated blood sugar, as you put it. But it goes beyond just the sugar. It's cut across virtually those other macronutrients in the body.
So is it a black man's disease or is it a global thing?
Oh, it's absolutely a global thing. It's initially we would term diabetes to be the disease of the rich man, but now we know that both the rich and the poor are not spared from this disease.
Right. So what are the types of diabetes that we have?
Okay, so broadly we look at the types from type 1 and type 2. However, of course, there are other divisions or types of diabetes, but broadly speaking, we have type 1. Basically, in type 1, there is no insulin at all. Insulin plays a critical role when we look at driving glucose into areas of the body where it is
and what is insulin?
Insulin is that important hormone produced by the pancreas. So the way God has designed our bodies in such a way that whatever we eat is broken down into basic units that the body can make use of, and insulin helps drive the glucose into areas of the body where it is most needed. So for type 1 patients, they do not have insulin at all.
Right.
For type 2, however, they have insulin, but the insulin is not doing what it's supposed to do. So you have a lot of insulin around the body, but it's not really functional.
Right. So you mean insulin is discriminate? Is it discriminatory so that it appears in some people and it doesn't appear in some others?
Not that it's discriminatory, but for patients who have type 1 diabetes, for sometimes unknown reasons, there is what we call autoimmunity. The body kind of wage war on the pancreas and destroys the pancreas. So it is like you have a manufacturing house that cannot produce anything.
Oh.
So for them, the pancreas cannot produce insulin. And but however, for type 2 diabetes, their pancreas can produce insulin. It's just that the insulin may not be able to do what it's supposed to
do effectively.
Yeah.
All right. And so what causes diabetes, Dr. Ibidapo?
Yeah, so for type 2 diabetes, basically, there are like pillars or the risk factors for type 2 diabetes. One important one is obesity. So when you have increased weight gain, that could be a problem. Another important factor is hereditary. When you have a family history, that puts you at risk of having diabetes. Another important thing is sedentary lifestyle. Nowadays, we're kind of exposed to fast life. We want everything quick. So restaurants, you get your junk foods and all that. Those things contribute to high calories, and your high calories ultimately affect your weight, and that can increase your risk of diabetes.
Right. So when we look at that aspect of hereditary now, when you say it can be inherited, right?
Yes.
So a man who has diabetes, his wife also has diabetes.
Yes.
Can that be transferred to all the children, let's say about 4?
Yeah, so it's not just the genetics that plays a role. The environment, actually, we look at it from both the hereditary and the environmental risk that the person has. So if a father has, a mother has, the children are at risk of having diabetes. What that speaks to is the fact that it's just a risk. They may have it, they may not. It's now left for them to put up strategic or put up a strategy in avoiding or in preventing diabetes from occurring in them.
What are the signs that will show that someone is coming down with diabetes?
Okay, so diabetes is a dynamic disease, really. Sometimes it can come with symptoms, sometimes it may not. But most times it does. So one of the symptoms that you notice is frequent urination. You notice that you'll pass a large volume of urine. Another important thing is people with diabetes, they may get tired easily. Sometimes, again, they may have recurrent boils. They have this boil that keeps coming. They treat it, it comes back again. Another symptom may just be wound that is not healing.
Okay.
So you have a protracted wound that is not healing. That could just be a problem. And then one other important thing is most patients who have diabetes notice that they lose weight. They will despite the fact that they are eating a lot, they eat, but yet they are losing weight. So those are just symptoms that could point to diabetes.
So can diabetes be cured?
Well, as of now, we don't have a cure.
Okay.
However, we talk about remission in diabetes management. So
that's remedial intervention.
It could remit in the sense that someone who has diabetes could, through good management and good intervention, could become close to normal. But if those interventions are not continued, they could revert back to being diabetes, to having the diabetic range.
All right, so let's talk about diet now for a diabetic patient. So someone who is diabetic, he should avoid sugar totally?
Well, you can't totally avoid sugar. And that's a misconception, because people used to say that sugar is, for those who have diabetes, they should not take anything sugar or carbohydrate or anything like that. What we advocate for is a balanced diet. It's just a balanced diet that will contain carbohydrate, protein, and of course your fats and oil, more of vegetables. So that is what we advocate for.
All right. So can one who is diagnosed with diabetes, can he still take alcohol?
Now that's when we look at alcohol, it's not totally contraindicated in patients who have diabetes. However, they should take it in limited amounts.
Limited amounts, yes. Right? Okay, so they can still flange you on a Friday like this one. Okay. All right, some questions are popping in here for you, Doctor. It says, good morning, Victor. Can diabetes be effectively prevented, or is it primarily a genetic condition? Sharon from Ilikpeju is sending this one in.
Okay, so diabetes can be prevented, and that's the reason why at Rjolad we are here to help you, kind of live a healthy lifestyle to prevent diabetes. So it could be prevented by your lifestyle changes, diet, physical activity, reduction of your weight, and those are things that would help you reduce your risk of developing diabetes.
Okay, so this one says, morning Victor and Dr. Raphel, can regular exercises help in diabetes control? Imoli Ayo is sending that one in.
Oh, absolutely. So regular exercise, it has been proven to help in managing diabetes. For exercise, we advocate for at least 150 minutes per week. You can spread it over the days, at least 3 to 5 times in a week.
Okay. So you're talking about 30 minutes per day?
Absolutely, 30 minutes, average of 30 to 45 minutes.
What kind of exercises, by the way?
So they could do aerobic exercises, brisk walking. We advocate for that. They could also walk around. For those who cannot do brisk walking, they could jog, they could skip. All those are exercises that kind of helps the whole body.
Dr. Ibidapo, from your own assessment, don't you think people shouldn't be dying at all from diabetes? If now. So what's the if there?
Now, the if is the awareness, number one. Number two is the financial capability to access healthcare. And number three is if the government would also in a way subsidize the cost of diabetes management.
Is it very expensive to manage diabetes?
Absolutely, it's very expensive right now. It's very expensive.
All right, we'll talk about some of the interventions that you guys are bringing on board from Rjolad. This one says, good morning. Are continuous glucose monitoring CGMs accessible in Nigeria, and how effective are they? It appears this person must be a doctor or something.
Okay. So yeah, CGMs, that's the continuous glucose monitors, are available now in Nigeria. In our conference that we held in Abeokuta sometime in September, there is a company in Nigeria right now that produces CGMs. Yes, and I think it's very much available, is accessible. CGMs are very good. Of course, the cost may be a challenge for our people, but it's something that people are now beginning to use.
But it's very useful.
Absolutely.
All right, this one says, good morning, Doc. What steps can someone with pre-diabetes take to prevent progression to type 2 diabetes? Chris is sending that one in. Pre-diabetes, anything like
yes, so there is a pre-diabetic stage of that for some individuals, and some of the lifestyle changes that we've highlighted are the things that they will do. If you're obese, try to check your weight. Move more, and that is your physical activity. Look at your diet as well. Eat based on your portions, not just eating based on how the food is available, the quantity of the food.
All right, let's talk about Rjolad now. So what interventions are you guys bringing on board to manage or do a comprehensive management of diabetes?
Okay, thank you very much. So we have a multidisciplinary team that helps in managing diabetes, because diabetes requires a comprehensive assessment and management. So the consequences of poor treatment of diabetes could affect every part of the body. But we have a specialized team that assesses any diabetic patient: ophthalmologist, endocrinologist, nephrologist. Those are other doctors, other specialists that help in taking care of diabetes.
What tests will one do for one to find out if he's diabetic or not?
Okay, so again, in Rjolad we have for screening, we do a fasting blood glucose for them. We can also do oral glucose tolerance test. We have those facilities there that can help both in screening and diagnosing diabetes.
All right. So where can we find Rjolad Hospital?
So we have our handle at www.rjolad.com. Also have our just a minute.
Your contact line, so?
Yes.
Okay, let's see if we can quickly sift through that, and let's have it.
So our contact line is 07 000 75 65 23.
Let's take that again. 07
000 75 65 23.
All right. So once they call that number, there's somebody at the other end.
Absolutely.
All right. There's a question that's recurring here. Somebody says does having diabetes prevent good activity in the other room?
Oh, yes, it does. In fact, that's one of the common questions I get asked in my clinic, particularly for men. And it's important that for men who have diabetes, their glucose control must be very good.
Okay, so they need to work on it.
Exactly.
Any scares? Can I bring any fears for them?
No, absolutely, because it can be managed, it can be treated, and it just requires a lot of commitment from our patients.
All right, then we'll leave it at that for now. It's nice having you in the building, Dr. Ibidapo. Thank you so much.
Absolutely, it's a delight to be here.
All right, he's one of the rare medical professionals that we have around. He's an endocrinologist, and he's a consultant endocrinologist with Rjolad Hospital. And we've been trying to see how best we can enhance healthy living through comprehensive management of diabetes. We're going to take a short break right now. When we return, it'll be time to do our birthdays, and then we're still going to be talking about the Gamma Awards.